Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Samood Ahmed. He's a psychiatrist and he's the author of the book Medical Marijuana, a Clinical Handbook, and he wrote the Kevin MD article, COVID-related stressors and increasing instances of substance abuse. Samood, welcome to the show.
Thank you so much for the invitation.
So we'll get into your article in a little bit, but first off, can you just share your story and your journey to where you are today?
I have completed my residency at NYU. I have been at Bellevue Hospital and at New York University for, I would say, close to 30 years now. I have completed my training there, and I run an inpatient unit at Bellevue Hospital, as well as on the faculty as a professor at NYU. And I run an Integrative Center for Wellness, which is a combination of psychiatric issues in conjunction with wellness, weight management, particularly as we understand people with severe persistent mental illness have higher rates of metabolic issues as well as obesity, and I integrate other modalities to help my patients with that.
So tell me a little bit more about your integrative practice. So what kind of patient population does it serve, and what are some of the other modalities that you use to help them?
It's a private practice, so I think I see both ends of the spectrum. Because of the Bellevue, I'm seeing severe persistent mental illness and homelessness and substance use. The private practice is comprised of people who have good support systems, have jobs like yourself and mine, and businesses, professional people. Mostly I specialize in bipolar disorder, anxiety treatment-resistant depression, people with post-traumatic stress disorder. Those are primarily, and many of these patients are struggling apart from their psychiatric ailments with other medical issues as well. So the approach has been, I think both of us know, in terms of people with psychiatric ailments who are taking psychotropic medications, which do carry a higher risk of metabolic disorders. Many of them have a predisposition to obesity. Some of them already overweight or obese. They have very unhealthy, unhealthy lifestyles, as well as struggling with substance abuse. So the idea is to bring not just, give them medication and a pill, but to have some life-changing modalities that will carry them throughout. And I think I'm against the whole idea of these so-called diets that people take, because diets only last as long as you give them the diet. As soon as that goes out the window, people go back to you can watch it on The Big Loser on television, people gain 200 pounds back. But my idea has been, rather than diets, is a lifestyle modification. So I literally formulate a plan with the people, and I sort of, with my personal experiences and my own journey in terms of my routine and how to eat and what to eat, and literally guide people on a regular basis about how to shop, whether they're in a diner, whether they're at a home, whether they're at a party, what they're eating, how they're eating, and share your story, which is not unusual. Literally, people sometimes have called me, I'm in a shopping mall, grocery store right now, and I'm struggling with this, and there's so many things. And I literally have taken the time, a few minutes, to literally walk people through it as to what they can do and how that may be helpful for them. Those are the kinds of challenges that people face on a day-to-day basis. And I don't want to sound in a negative way, very personalized way, concierge in dealing with patients, where my availability is literally 24/7 for my people. Because the people, I find that if I was struggling, whether it's a stress related to anything, particularly in COVID times, the availability and even taking 5 minutes out of your daily routine to immediately respond to that. That's the kind of a support, particularly people who are struggling with bipolar spectrum conditions, where moods fluctuate on a daily basis or weekly, the availability. And that's what I have integrated into my practice to help people in different domains, not just medication.
All right, so let's transition into your Kevin MD article, COVID-related stressors and increasing instances of substance abuse. Now, for those who haven't read your article, can you walk my audience through it and maybe share the story of why you decided to write it?
To give a little context, I think we all understand the use of substance abuse, particularly the opioid epidemic that has taken place in this country, and the toll, where it was sort of thought of as a sort of a benign issue, which is, well, the pain. It was in fact, one of the main standards that people could take charge of their own pain and even infusions and do that. And over a period of time, we realized how it's taken a toll. And I think we also understand that in terms of as people become more isolated, they are more likely to get more consumed with things that when they're lonely, they're more likely to segue, whether it's alcohol, whether it's cannabis, whether it's any other drug. And as a result of that, I found when the COVID happened, I felt that I was seeing patients who were frequently calling me, and this was one of the main struggles that they were experiencing at the time. I thought it would be helpful for many other people who may be having a similar issue to sort of realize and understand how substance abuse is playing a role and the stress that they are experiencing, what are the long-term implications of that stress. That was the pretext of how I got into this article. And, just to give audience an idea of what this was, I certainly wanted people to know that even though we are in the midst of this, some of the times the emotional, psychological impact is not felt actually in the long term, there may be a time lapse between when you are having the effect versus when you see the effect. And this catch-up game will have a significant impact on the society in the long run. And nobody was talking about it. We were so focused on the physical aspect of things. So I think for our audience to know that it's one of the important things is that stress is not just something of a mind game. It has a significant impact on our physiology in the body. And I wanted people to realize that in the long run, that may have an impact on their physical health as well, apart from just the substance abuse, which they are taking to satisfy their loneliness, their depression, their anxiety. That was one of the things that I wanted to highlight. So that brings into context a little bit about the acute stress disorder and post-traumatic stress disorder. Any of us, whether we are witnessing the death of a loved one, have gone through a traumatic experience, have seen something horrific, depending upon our predisposition, our resilience factors, our development, our environment, we may at times respond to it in a way which in the long run will predispose us to acute stress disorder. Usually the defining line between acute stress disorder and post-traumatic stress disorder is that if the symptoms last up to a month or so, we call it acute stress disorder. If it goes beyond that, it becomes post-traumatic stress disorder. And most of the times, if you treat it appropriately, people who struggle with post-traumatic stress disorder, usually 2 to 3 years, most of their symptoms will subside. However, untreated, it can go on for years and takes a big toll on their emotional well-being with symptoms which are hyperarousal, hypervigilance, sleep issues, appetite issues, irritability. And about 50% of these people struggle with substance abuse. So that is the interface between, if you think about COVID, the impact in terms of the stress, as well as the substance abuse. There's people who are struggling with this, and then 50% of them will go on to use or abuse in some way, some form of drugs. Taking that on, and to further, which is how that ties in with the stress and how it impacts our body was the next phase, which is that there is something called hypothalamic pituitary adrenal axis. We all respond whether, we are faced with something terrifying, which at the heat of the moment, we need that cortisol rush. And I think most of the audience probably are aware of cortisol as the stress response, which is actually very beneficial in the short term. However, even low levels of hypercortisolemia or the stress response over a prolonged period of time can have a devastating effect from the brain to the body. And I think people probably should know more about how the physiology impacts our body, because hypercortisolemia can lead to obesity, it can lead to hypertension, it can increase the inflammatory cytokines, which can have significant impact on inflammation. It can cause kidney damage, it can cause arrhythmias, it can cause increase our blood sugar, our lipid profile, cardiovascularly, it impacts us. And these things people may not notice in the short term, but one needs to be cognizant of it. And most of all, I think it's work cut out for mental health professionals. We are at the interface of mind and body. If we are the ones where patients feel comfortable and honest enough to listen to us, they put their trust in us. If we go beyond just giving them an anti-anxiety or antidepressant or something else, and really walk them through and allay their concerns and educate them in a drummed down, simple fashion about how the stress is impacting their body and how even in isolation, they can keep that stress low, we may be able to offset these long-term cardiovascular and other problems that they may face down the road. That's, in crux, I think that's the summary of the article and what I would, the people who have not read it, I can summarize.
Now, for these patients who are under stress because of the pandemic and are prone to substance abuse, what are some of the treatment options that you can offer them?
I think that brings into the role of many of my patients that approach me on the cannabis issue, I'll tell you. So some of them are obviously drinking, which has been a lot more. And people don't realize in a 4 or 5 year period, there was a study done. 100,000 people have died because of alcohol abuse. That's a significant death toll, I have to say. Apart from that, one of the other things that have happened is because of the substance abuse and lack of so-called accessing what they were used to taking, there have been extreme rise in other drugs, including people were taking high potency like fentanyl, which has just deadly impact because people were more tied down and whatever they could lay their hands on, or they were using in a lot more quantity because to get rid of that stress. And, people couldn't travel, people couldn't do anything. So the only way that we've been able to help people is through telemedicine and being able to sort of convey whatever we could and listening and giving them sort of a routine and a structure to their daily lives. I think apart from the medicines that we use in many ways to help people, whether any of the abuse or use is taking place of the substances, and there are many of those medicines that can play a role, obviously, on not only anti-anxiety and antidepressant, but things that can decrease the triggers and the need for these substances. A daily structured routine, whether it's relaxation, muscle training. I would sit down with my patients on the telemedicine and sort of do breathing exercises with them. I would literally teach them what are some of the stationary exercises they could do at home, what was available to them, how to walk you through meditation, yoga, sleep structure, keeping a daily routine in check, not just being up all night. And people literally lost track of day and night in their routines, accessibility to because of the social media. Constantly, they could not even make a distinction between where their work life and their social life, because everything was online. Yeah. So you really were being bombarded with all of this, whether it's good news, bad news, fake news, it doesn't make a difference. And how do you filter it? And that's the kind of a connection that was essential to have with your patients. So those are the kinds of things that I have done with my patients to help them through this time.
We're talking to Samoon Ahmed. He's a psychiatrist, and he wrote the Kevin MD article, COVID-related stressors and increasing instances of substance abuse. Samoon, I'm an internal medicine primary care doctor, and on this podcast, we have a lot of primary care clinicians who may be listening. Now, what are some red flags we should look out for patients that we see every day in the office? And maybe what kind of questions should we be asking them to perhaps uncover some undiagnosed potential substance abuse?
One of the main problems is that many of the people don't want to delve into asking many of these questions. They don't feel that they could do much, especially when they are not with the patient. And it's like opening up a Pandora's box, but I think it's extremely important to actually ask those questions. And sometimes I'm really surprised when you ask people, do you drink? And the answer is, yeah, not more than anybody else. And my next question is, what do you mean by nobody else? How much do you think other people drink or other people, smoke or what they do? And I'm surprised how people overestimate what other people do. And many times then they rationalize in some ways their behavior if it's a healthy behavior and they're not drinking, So I will ask someone, well, what is your average consumption of alcohol in a week? And people will say, I would drink probably 2 bottles, or I'll have 2 to 3 drinks a day. And if you look at all data that's coming out, and the one that just came out recently, where they even cut back for male to female ratio, it was used to be 2 drinks for males and 1 drink for females, with a maximum of 5 to 6 drinks in a week. They have cut down that males should even have 1 drink per day, and females as well 1 day for that. That's the kind of a main question that you need to, I think, start. what is the consumption that on any daily basis? Some people will say, well, I really don't drink throughout the week, but then yes, I will have 4 or 5 drinks on a weekend. Well, that's unhealthy because that's more along the binge drinking that people are doing. That's the kind. Or people will say, well, I just, smoke here and there, some marijuana. Well, what do you mean by here and there? What exactly do you use? Are you vaping? Are you smoking? Are you using in some edibles? What are you, and how is it impacting your life? Do you sleep a lot? Has your appetite increased? Do you find yourself that you are just watching TV? What are you exactly doing? So tying what they are doing to a behavior, whether it's social, it's professional, it's personal. Are they isolating themselves? Are they connecting with their family? And those are kinds of the things that raise red flags for me, which is seeing, are there any cause and effect relationship for what they're doing? I mean, I have patients who would tell me, yeah, sometimes in the evening I come and I just smoke a little bit of marijuana, and then I just relax. But I go to my job every day. I have a loving relationship with people and all of it. That's very different than somebody who's, wakes up in the morning and smokes and is sitting in front of a TV with headphones on and just lost in their, and not conducting their life in a healthy way. That's very different. And there's no one size that fits all. You really need to see what the person's life is, what their professional responsibilities are, what their personal responsibilities are, and how what they are using is impacting that responsibility. So I don't think people should take it for granted and just take a general question viewpoint and then take it from there for applying it to everybody. You really need to make it very individual in some way.
Sure. You're also the author of the book, Medical Marijuana, a Clinical Handbook. Can you briefly tell my audience a little bit about your book?
This book comes from the fact that there are two countervailing perspectives to cannabis. On one hand, there has been such a tremendous and immense amount of interest overall in cannabis. There's such a drumbeat in the mainstream about, but it's really, I would say, shaped by our viewpoints, which are more based on culture, society, and politics rather than anything else. And that has been a problematic, I think, from the general public, and more so for the clinicians who are really not able to understand where we are with the science of cannabis today. And that is also shaped by the fact because of our training. And this impetus for the book actually comes from my journey through this. Because I can go back in time as a medical student, I was never taught anything about what I would call as the benefits or even therapeutic uses of marijuana. The endocannabinoid system wasn't even understood. I mean, back in the 1980s, it was in the 1990s that and even if today, you really have to go out on a limb on your own to study endocannabinoid system. And this is not a part of your regular curriculum as such. So on top of it, cannabis has always been put as a Schedule I drug. Meaning, what does that? It has no medical therapeutic application and a high incidence and prevalence of addiction. That in itself, for every clinician, becomes like, this is a territory that I shouldn't go to overall. That also limits any data, any science, or any clinical trials. That's sort of a self-fulfilling prophecy to me. Meaning, when you ask a clinician, they'll say, what is a Schedule I drug? Because there is no therapeutic application. Well, why isn't there a therapeutic application? Well, because it's a Schedule I drug. You cannot do any blind clinical trials. You have to go through hoops to achieve that. That circular logic doesn't work anymore, unfortunately. And I was on the two ends of the spectrum. An inner city hospital, 70 to 80% of population struggling with comorbid substance use, with having a great impact on their mental well-being. And on the flip side, seeing very high functioning people who were using it in a casual way to allay their anxiety, help with sleep, their mood, all of this. And I went looking for data, and I was amazed at how little or limited information, lack of clinical trials. And I said, if I am in this boat, how are the rest of the clinicians in this? So I started doing research and looking for this. And I thought, I need a partner in this who is a specialist in addiction, but also in policy making, somebody who has worked. And I found that great co-author in Kevin Hill, who is my co-author. He has worked with the World Health Organization, with the NFL, has done a lot of work on it. And we really wanted to come up with a textbook, not just another book for this, which completely eliminates any politics out of it and has a very objective scientific data, but double-blind clinical trials. And we wanted people to understand the history of cannabis, how it's been used for millennia in different civilizations, the science of the plant. This is not one drug. There are hundreds of drugs within one plant of the cannabis. And then how do you make that distinction? There are 140 so far phytocannabinoids that have been so far discovered. Out of them, 20 are so new, we don't even know anything about it. Mm-hmm. Out of the 120, only THC and CBD are the ones that we really have worked on. It is the most infancy at this stage as we see it. And the therapeutic applications, we don't even know. So there is data coming out at such a fast pace that's very hard for people to even keep up with it. And that is why we came up with the website cannabistextbook.com, which was, until the next book comes out, people can't wait for this information. Mm-hmm. So what we do is that as soon as a state regulation changes, the indications change, any new data comes out, no matter what that data is, whether it's on a plus or minus, but it's a clinical trial that suggests what the role of these cannabinoids is, we immediately post that for people to understand and read. So clinicians like myself have enough information on their hands, because the new data shows that approximately 80% of the clinicians find themselves not having enough information to educate their patients and other people in terms of what needs to be done. And this particularly is in the cancer, where the data shows that 80% of the oncologists felt they were not equipped in mm-hmm. any way to teach their patients and clients about the uses and benefits or adverse effects of cannabis. That was the real impetus of trying to, like clinicians like myself, educate and give them a tool that they could use in their clinical practice.
Sumoon, thank you so much for sharing your insight and spending time with us. Thanks again for being on the show.
Thank you so much. Really appreciate it.